Hi, my name is Lauren Preterm, and this is my colleague Cisan Cuervo. We are here to present a poster today called Family and Cultural Considerations when Working with Preterm Children. We are under the mentorship and guidance of Dr. Nancy Craighead.
So today we're going to discuss our dissertation projects. Both studies use data from a longitudinal multi-center study that is currently being conducted at Cincinnati Children's Hospital. So the ultimate purpose of the parent study is to facilitate preventative early interventions for better outcomes of children who were born preterm. I think we should say that when we refer to children who are very preterm, we're talking about babies who were born either at 32 weeks of gestational age or before.
Right, and that's correct. And from this database, again, like my fellow colleague said, we are doing different projects. For example, for Project A, which is mine, I'm looking at cultural sensitivity of standardized assessments for young children. From the parent grant, the assessments chosen were the communication and symbolic behavior skills and the MacArthur Bates inventory, which is called the CDI. So if you see those acronyms, that's what we're referring to. So the reason why I'm doing this is because within the participant sample, there's at least 30% of African-American or Black children within our participant study. And so we wanna make sure, since it's for preventative measures, we wanna make sure that the assessments that we're using to test or look at early language or communication skills are sensitive and are can be culturally modified, for these particular participants. And so, which is why I am looking at the sensitivity of these assessments to see if there are any differences between them, between the white children and the Black children, as well as looking at it from the MacArthur Bates and seeing if there is a correlation between the two to examine these differences.
And for Project B, a little bit of background is that we know that mental health and resilience of these mothers postpartum is essential for the family functioning and for the child's language development. So my project is going to be looking at postnatal distress. I'm going to look at levels of anxiety and levels of depression in mothers and how that may relate to the child's language outcomes when they turn 2 years old. So just the ultimate goal of this project is to see how language and distress relate to each other. And then if there are some characteristics of the mom that may influence that relationship. Mm-hmm. So we're going to be looking at grit and mm-hmm. self-efficacy of these moms. Mm-hmm. And we're going to see if those two characteristics affect or not the relationship between postnatal distress in mothers and the language outcomes of the children. So we're going to be using several measures for language outcomes. We're going to be using the Bailey Scales of Infant and Toddler Development. And then for maternal distress, we're using the PHQ-9, which is the Patient Health Questionnaire. And for anxiety, we're going to be looking at the PROMIS, which stands for Patient Reported Outcome Measurement Information System. So all these tools are there. I am having in my study about 243 participants. Mm-hmm. And I think you'll have
about 50 and a third of that being, or a little bit more. So the estimated right now participants is 100, and hopefully we'll have a third of that to assess and randomly select white children to match the Black children. So we have that in our study.
And so our timeline for just presenting our results are, we're currently collecting data mm-hmm. and we're hoping to analyze by the end of the fall mm-hmm. and begin kind of finalizing the project by the beginning of next year. Yes. So stay tuned. If you're interested in our work, we would love to hear from you. We are at the University of Cincinnati. Mm-hmm. And that's that.
Yeah. Thank you guys. Bye.
Bye.